How's it going, everyone? It's Rev here from Rev's Fitness. Today I'm talking about knee pain. So knee pain tends to come up a lot, from people I've met for the first time, even to a certain degree, people who are doing a lot of training and they've got a bit of pressure, a bit of tension in their knees. And I'm just going to go over some very more common and frequent reasons as to why that might be the case. Yeah. So number one might be that you aren't rolling out your quads, you're not stretching out your quads, right? So if you've got like your thighs on the top, if I was to look right down, I'd be looking at my thighs. Those are my quads. If you neglect to stretch them out, if you neglect to give them a bit of a massage roll, I've got a video about massage rolling for the legs on my blog if you want to check it out. If you neglect to do that, you get a lot of tension from working those muscles all the time, and that tension is accentuated down toward the actual knee joint. Yeah. So although it might feel like something that's very specific to the knee itself, sometimes, a lot of the time I should say, it's more often tension that's referred down to the knee joint. So what you can do is maybe every second day, maybe even every third day, especially after you hit legs, after you do a leg session of any sort, even if you're going for a run or doing any sort of cardio where you're using your legs, make an effort to try and massage roll them. You can get these massage rollers from Kmart for about $15. They're really good. And just roll all sides of your thighs so that they can actually get an opportunity to lengthen out and to get new and reoxygenated blood into the area so they recover faster, yeah? So that's tip number one. Tip number two might be like a patella tendonitis or something like that, or more specifically that your kneecap or patella, again, might be tracking in a different way and it shouldn't be tracking that way. So what I mean by that is, if I look at this, right, this is my finger. Let's say that is my kneecap. When you do a squat, right, that kneecap wants to be tracking right over your foot to be deemed like a really efficient position and to alleviate any pain that you might be feeling. Sometimes, if it more so comes down to muscle tension again, sometimes if your muscles are really tight either side of your thigh, it can pull the kneecap either in or out. More often than not, I think a lot of the times when people are getting referred to me from physios that their lateral or outside part of their quad is quite tight, like the outside of our thighs, and it's quite sensitive to roll, and it pulls the patella, pulls the kneecap out. And what usually needs to happen is we need to do two things. We need to stretch and lengthen out this side of the quad, or the lateral part of the quad, which is quite sensitive, so go nice and slow if you're rolling, as well as strengthening the inside of the knee, or that teardrop shaped muscle on the inside of the knee. What you're doing there is you're stretching and strengthening to pull that patella, that kneecap back in alignment, so that when you do squats, when you do lunges, when you do any sort of leg movement, that you can actually do it with relative ease without feeling any knee pain, yeah? A really good indication that that might be the case is, especially in colder months when it's a little bit more chilly if you're training in the morning, is if it takes a while to warm up and you feel that kind of that pressure or that acute pain on the knee itself, and then as you warm up it gets better, it's a good indication that that's usually the case. We need to try and number one, spend a bit more time warming up, and number two, that we need to spend more time again stretching and strengthening the right parts of the thigh and the quad. Yeah. So if you have any questions on that, which I'm sure you probably will, just let me know. You can send me a message on my Facebook page, Rev's Fitness, and I'll talk to you then. Yeah. Otherwise, have a good day. See you later.